cancer cells and can be treated usually in cycles. Aims of therapy can be curative. Chemotherapy alone can be a cure for many types. Adjunct, to reduce the risk or recurrence, to increase the risk or chance of a cure. Neoadjunct, to help shrink the tumour prior to resection and reduce risk of recurrence. Palliative, to help improve cancer-related symptoms and potentially extend the life. Side effects depends on the exact drug, but usually includes nausea, vomiting, hair loss, mucositis, myelosuppression, neuropathy, cardiotoxicity, infertility, neuroperic sepsis. Radiotherapy is an ionizing radiation targeted at cancerous cells and causes DNA damage and cell death. Normal cells may be affected by radiation but have a greater capacity for repair. Gray, a unit of measurement for absorption radiation fraction, a single treatment. Types can be external beam, like spinal cord compression. A machine outside the body generates beams of radiation that can precisely target at the tumour. Branch therapy, for example, in prostate cancer, small pieces of radioactive materials are inserted into the tumour to deliver localized radiation. Molecular radiotherapy, used in thyroid cancer, are preferably taken up by tumour cells, delivering localized radiation. Aims of therapy can be curative, usually given by dialysis, using a longer time course. Palliative, usually given at a lower dose over a shorter time period. To minimize side effects and number of hospital visits. Side effects can be fatigue, skin changes, nausea, and mucositis. Hormone therapy, drugs that mimic or block the actions of certain hormones that some cancer cells rely on to grow. This approach is mostly used in breast cancer and prostate cancers. Adjuvant, a lot often used alongside therapies to prevent reoccurrence. And palliative, to help improve cancer-related symptoms and potentially extend their lives. Side effects of this can be fatigue, headaches, nausea, hot flushes, and increased osteoporosis risk. Targeted therapy are drugs that target specific mutations in cancer cells. These drugs often affect cells that express the target and therefore are more specific than chemotherapy or radiotherapy, and potential results in fewer side effects. Types can be small molecules. These agents are small enough to enter cells and prevent tumour growth, even through several mechanisms and angiogenesis inhibition, preventing blood vessels formation and growth, signal blocking. Monoclonal antibodies, molecules that specifically attach to outside of the cells and may block signaling to prevent cell division, label cells for destruction. And a cytotoxic drug. Aims can be to combine with other therapies to prevent reoccurrence, or palliative, either standalone or in combination with cytotoxic and chemotherapy. Side effects of this can include diarrhea, mucositis, hepatitis, hypertension, and rash. Immunotherapies are used to attack cancer cells. Cancer cells often survive because they are not easily recognized by our own immune cells. Immunotherapy aims to increase the immune system's ability to recognize this and destroy them. Monoclonal antibodies are specific to cancers and act as labels, enhancing the immune system's ability to detect cancer cells. Chimeric antigen receptor T cells are highly specialized treatment that involve retaining the patient's own immune cells into a lab to target specific tumor cells, and then these T cells are